Elizabeth Disu. I'm a professor of pediatrics at the newborn unit of the Lagos State University Teaching Hospital. I also teach at the College of Medicine. I am also the founder of an NGO, the ADA Maternal and Child Health International Foundation, which seek to reduce maternal and newborn deaths, particularly the preventable ones. Okay, today I'm going to be talking about obstetric fistula, or an overview of obstetric fistula on the occasion of the commemoration of the WHO International Day of End Obstetric Fistula, which is supposed to be on the 23rd of May 2020, which is Saturday. And it is important to know that in the year 2012, the WHO began commemorating end of obstetric fistula for very good reasons we're going to find out shortly. And the theme for this year's end obstetric fistula is end gender inequality, end health inequality, and end fistula. When we talk about fistula, why is it important? It's important because it contributes to maternal deaths. Maternal mortality in the whole world is about according to 2017 WHO statistics, it's about over almost 300,000, precisely 295,000 deaths of women during childbirth. And obstetric fistula is one of the causes of these deaths. Majorly, these deaths occur in the low-income and middle-income countries, of which Nigeria is one. And one of the most devastating aftermath of obstetric fistula is childbirth is obstetric fistula. And what do we mean by obstetric fistula? Obstetric fistula is a hole or an abnormal opening in the birth canal that results in chronic and continuous leaking of urine or feces, or both of them. This condition has been on for a long time. Even in centuries ago, it had been recognized. But according to the 2019 Federal Ministry of National Strategic Framework for the Elimination of Fistula in Nigeria, there are about 12,000 fresh cases per annum in Nigeria. And we have a backlog of about 150,000 fistulas that are awaiting repair. So Nigeria remains a significant hub for the burden of obstetric fistula. Besides that, we also know that majorly there are three types of fistulas that occur in women. The obstetric fistula constitutes about 80 to 90% of these fistulas. But fistula can also occur in the course of doctors doing their work. Probably during cesarean section, there could be an inadvertent mistake that will cause a cut that might lead to fistula, but these are very, very few. The third type could be traumatic, and that could result from sexual violence, and usually we'll call that gynecological fistula. So, how does obstetric fistula occur? It generally caused by several days of obstructive labor. When a woman is about to deliver and her pelvis, the outlet for the baby, is narrow or reduced, then there is an obstruction and the head of baby will keep on pressing down, not able to come out. The delivery does not take place. And if this goes on for a couple of days or more, the delay in this and absence of medical intervention like cesarean section, particularly emergency cesarean section, could lead to soft tissue damage, whereby the head of the baby pressing on the soft tissue causes the cut-off of blood, and that causes what we call necrosis, which is dead tissue. The necrosis will now can be between the vagina of the mother and her bladder, or a bladder and a bladder in between, or the vagina and the rectum. When this lack of blood occurs and there is this damage, then it will result in the vaginal fistula. A common connotation in medical parlance is vesical vaginal fistula, or VVF. We probably will hear people talking about VVF, which means, vagina and the bladder injury that causes this leakage. Now, this fistula problem causes a lot of social and clinical problems. A study was done in Jos in 2004, published in the American Journal of Obstetric and Gynecology by some workers, notably one Dr. Walls. And he looked at about 899 cases that we are seeing in Jos at that time. And he discovered that they had some certain characteristics. They were mainly uneducated people. So the predisposing factors of these characteristics that lead to obstetric fistulas include poverty. It includes low socioeconomic status. So because the woman is poor, she has inadequate access to medical care. She's unable to afford the basic health care, or it's not just available for her. Then there is lack of emergency obstetric care as well. And they are usually younger children. Obstetric fistula can occur across all ages, but most of them are younger women, particularly women who get married, or maybe teenage pregnancies resulting in from early marriages, or resulting in having babies when the woman is not really mature enough to be able to have babies. So what are the complications? The complications can be physical, it can be clinical, and also it can be emotional and social. Like I said, if as a result of gender inequality, as well as health inequalities, the complications will result in damage to the reproductive organ, whereby there could be cessation of menses, there could be scarring of the uterus, and that can lead to infertility. The woman will just not be able to deliver again. There can be painful intercourse, and there can also be renal damage, which can lead to renal failure. But most devastating is the unpleasant odor that they carry around, because they are forever smelling, having a stench of urine. We know what, urine that has lasted a few days can smell like, despite being clean. To add to that, these women will, most of the time, they lose their babies, so they have a stillbirth because of the obstructed labor. And when they have a stillbirth, they go into depression because they mourn their babies. There is the bereavement, for loss of a child. Then they are abandoned when they start leaking urine. They are separated from their husbands, or there is divorce. And then they are dependent. Their means of livelihood, economic deprivation occurs because their means of livelihood is no longer there. And then they are badly stigmatized in the society. So these are, a lot of problems that occur as a result of this. What can be done? First of all, prevention. Preventive measures include, delaying the age of first pregnancy, so that the woman's a woman of childbearing age has developed her pelvis and is, wide enough. The outlet is wide enough for a baby to come out and prevent obstetric labor. And then cessation of some harmful traditional practices. There are some traditional practices that involves cutting of the clitoris or all kind of other things that occur that can also lead to this obstetric fistula. And most importantly, timely access to obstetric care. Women should attend antenatal care. Antenatal care should be accessible to all Nigerian women. So we, hoping that our government will be able to enforce the Child Rights Act, which, forbids, child marriage, of which Nigeria is the signatory, whereby children who are underage will not marry. Teenage pregnancy, children marriages should no longer, occur. If that can be prevented, then we'll have less cases of obstetric fistula. A lot of attention has been paid by so many international NGOs in recent times, and there are comprehensive obstetric surgeries that can correct this. So women should make themselves, avail themselves, particularly women in countries where this is common. And among all the low income or middle income countries, like I said, Nigeria is one of the highest that has, has a lot of cases. But we are not the highest, but that doesn't give us comfort. Ethiopia has the highest number. Uganda also has a lot of them, and Sudan as well. But we can actually reduce this big problem, this devastating health outcome for women during childbirth. And unfortunately, in this era of SARS-CoV-2 infection, coronavirus has not made things easier. In fact, it has worsened the situation, because now, because of lockdown and quarantine, there is increase in child sexual abuse, there is increase in child pregnancy, and there is increase in child marriages. Pregnant women are most likely to miss their antenatal care because the clinics in most hospitals are closed, as attention is diverted to the treating of COVID patients. There is also decrease in attendance of family planning and counseling, and this has also decreased the access to contraceptive pills, which will have prevented such kind of pregnancies. So, and there is a lot of delays in all the programs that were geared towards preventing female genital mutilations, because this will also lead to obstetric fistula because of the mutilation. And of course, all this that we have mentioned will cause unwanted pregnancy. So these are things that can be done. So what can we do as healthcare workers? We continue. First of all, this is a good avenue. The commemoration of the end of obstetric fistula, WHO International Day, which is 23rd of May, we should commemorate it. We should ensure that there is health education, there is advocacy, and the government should get involved to educate the populace, so that we can, because of the stigmatization, a lot of women hide away, unable to come out to say what is happening to them. And we know cases that have stayed for over 12 years, 10 years, just carrying this around all their lives. And once they avail themselves to surgery, which is available in most hospitals, the many United Nations and WHO organizations have centers for treatment. I know that in Ebonyi State, there is a center there where BVF is treated. They are being treated in lots of centers in the north. So if we let women know that they can get treatments through surgery, unfortunately, it is not cheap, and on the average, it costs about $600 for one surgery. But then, the stigmatization and the death of mothers can be prevented if we do this. So we appeal to government to please step up her game in preventing obstetric fistulas and reducing maternal deaths. The IBA Maternal and Child Health Organization is an organization that seeks to end preventable maternal deaths. And we have been teaching healthcare workers on essential newborn care, on emergency obstetric care, and how to just end this problem of maternal deaths, because Nigeria has one of the highest in the whole world. We also partner with other organizations in the past, and you can check us out on our website, AMCH Foundation website. We'll also want to commend Yes We Are Winning Foundation, which has actually been in the forefront of promoting awareness on obstetric fistula. Yes We Are Winning Foundation arranged this interview, and they encourage people to, I'll encourage everyone to visit their website and their social handles. And there are articles there for more information. Yes We Are Winning Foundation says we care, educate, encourage, and empower to win.